Welcome back. My name is Robert. I'm a registered nurse, and this is a continuation of today's presentation on how to create a detailed list of your loved one's medications and how to help manage in a home environment. In the scenario which is about to be discussed, your loved one lives by you and you're going to their home to help manage their medications. First, after locating again where your loved one's medications are kept in the home, keep in mind that heat and moisture at times can lead to deterioration of medications. That's why it's not recommended to keep medications in a kitchen or bathroom setting. A suggestion to review with your loved one's primary doctor can be the idea to place your loved one's medications in a small box that can be kept in a cool, dry temperature area, such as a linen closet. If your loved one takes, in addition to prescribed medications such as over-the-counter medications, supplements, or as-needed PRN medications, I would recommend to make 4 different small boxes for each one, writing on the box cover and sides what they indicate. If a certain medication has to be kept in a refrigerator, place a note in the suitable box stating where that medication can be found in the refrigerator. To help further distinguish between prescribed medications and as-needed PRN medications, since both may be found to be in a pharmacy vial, I would recommend to mark the as-needed PRN medication vials with a highlighter, such as a pink color, and mark the box there to be contained within with a pink highlighter as well to show correlation between the two. To better recognize your loved one's medications, you can place one of the pills in front of the vial it came out of and perhaps write the name of the medication in big letters on a small slip of paper, placing it underneath or above the pill with the vial at the very top, and take a picture of it. The reason is that if a pill is found on the floor in a seat or sofa cushion, or if your loved one has a care aide who calls you on the phone and tells you they found a pill somewhere in the home, this might help you determine which one it is instead of going through each vial to find that out. Now, there are existing apps that are available that can be used to help identify a medication, or simply choose to ask a pharmacist, but this method could save time. Another step to take can be to write out the name of each medication on a sheet of paper, and next to it, list the medication side effects, such as nausea, diarrhea, rash, etc. If your loved one does develop a certain side effect attribute, this might help narrow down a possible cause. An idea to help keep track of your loved one's medications as well is to place on a sheet of paper the names of the medications and next to it how many pills are in each vial at the time you leave your loved one's home. An example, your loved one just filled at the pharmacy a 30-day supply with instructions to take 1 pill a day. If your plan is to come back to visit them in 5 days, then you should find 25 pills left in a vial. But if you find 27 or 22, well, why is that? Possible reasons you may hear could simply be your loved one telling you, I didn't feel I needed to take it that day, or I dropped one on the floor and after throwing it out, I took another. I couldn't remember if I actually took one, so I took an added pill from the vial, or if your loved one has a care aide, perhaps the care aide forgot to tell you that your loved one refused their medications one morning. Certain medications need time to build up in the body to be more effective. If your loved one is taking their medications sporadically, they might not work as well. Please notify your loved one's doctor if this should occur. In addition, another sheet of paper to consider to have ready is if your loved one takes as-needed PRN medication. A recommendation is to write the name of the medication and the date and time it was taken. An example is your loved one takes Percocet, an as-needed PRN medication for pain, which can be given every 4 hours. Your loved one takes it at 10 a.m., but at noon time, they're asking for another. If you didn't write it down and forgot when you initially gave it, you might accidentally give another, not realizing it would be 2 hours earlier than prescribed. Also, if you have to leave and another person comes in to help take care of your loved one, you can show them this paper so they don't accidentally give another Percocet before the 4-hour mark. If your loved one has Alzheimer's or another form of dementia, having them take their medications by mouth can be a struggle. In the hospital, while taking care of a person like this, I've come across multiple times after giving them a medication to find that it's still on their tongue or pocketed in one of their cheeks. I've even had patients afterward spit the medication up or reach in with their fingers, taking it directly out of their mouth. If you feel this could be a possibility, review with your loved one's primary doctor about what's called a prescribed placebo. Most pharmacies may not carry this, so your loved one's primary doctor may simply suggest you use a Tic Tac, and if you feel that's too big, cut it in half with a pill cutter. An example is, you start by giving your loved one a spoonful of applesauce with nothing in it. If they tolerate that, follow it by placing a placebo in another spoonful of applesauce. I would recommend to repeat this process twice. If they end up taking both easily, that can be assumed that it might be safe to give them the rest of their medications. The reason for this is if your loved one initially refused to swallow or they spit up the placebo, at least you did not waste one of your loved one's actual medications. A question to ask a pharmacist if you feel one of your loved one's pills is too big is to see if the pill is available in a smaller size or in a liquid form. If not, ask the pharmacist if this medication can be scored in half, giving each half pill separately, one after the other. Items to consider to have ready nearby can include a flashlight to check their mouth before and after giving a medication, a glass of water, but to understand first if your loved one likes their water lukewarm or cold. If they have trouble sipping up, you can cut a straw by a third to make it easier to drink from. A bag or item to throw up into if they get nauseous. Mouthwash to clear their mouth after all medication are taken. And again, a bag or item to spit the mouthwash into. Plus a wet washcloth to wash their face if food or spit up happens to get up on it. As I've been saying throughout and will continue to do so, these next two parts I do recommend you first review with your loved one's primary doctor before trying. Many years ago, when I did home health on the side, my position as a registered nurse for the company I worked for was to oversee care aides assigned to clients. One of the clients was diagnosed with Parkinson's disease. Upon my visiting their home, I noticed the care aide had been crushing the client's medications. I am not a fan of medications being crushed. I believe by doing so you can lose the potency of the medication, especially when you crush them together and give them all at once, because if your loved one doesn't take it all, it's hard then to determine what was truly given. As I was explaining this to the care aide, I noticed on the kitchen table a bowl of grapes. So I asked the care aide, does he take grapes? She said yes, which surprised me since grapes are usually avoided in Parkinson's patients due to a possible decrease in their swallowing ability. After sitting down with the client at his kitchen table, I asked if he wouldn't mind taking a grape for me. He was able to do so with no difficulty, and to be sure, I had him try again, seeing the same result. I then took a grape, slit into it, and after scooping some of the inside out, placed one of his prescribed medications that was due at that time into the grape. The client took the grape with ease, with my knowing the medication was taken whole. With this second method, I would first advise to determine if your loved one is not allergic or is able to take peanut butter without any difficulty. This would entail preparing items to be used prior to your loved one receiving their medication. Start off by giving your loved one a spoonful of applesauce with nothing in it. The next step, first using perhaps a placebo, is to again give your loved one a spoonful of applesauce, but underneath, stuck to the bottom of the spoon, is attached a small amount of peanut butter with the placebo inside it. You may first try to see if your loved one is willing to stick their tongue out as far as it can, and if so, slide it forward against the tongue as you have your loved one close their mouth, offering afterward a drink of water. If you feel your loved one tolerates this, try putting a single or two small pills in the peanut butter and repeat the process. Please don't forget to use a flashlight to shine in their mouth afterward to make sure medications were swallowed. Again, please review with your loved one's primary doctor before trying. As mentioned prior, giving medication at times can be a struggle, but in doing so, you may need to reflect back on yourself. Multiple times via home health or the hospital, I've seen family members outwardly show their frustration upon either feeding or trying to take care of their loved one. You want to instill a safe environment without judgment. Keep yourself calm throughout is important, and if your loved one starts to act out, I always say, don't raise to their level, bring them down to yours. Having a calm demeanor and instilling a kind, positive reinforcement attitude can lead to a more successful experience for you both. At this point, we're going to take a small break, so please stay tuned.